Spolno zdravje je pomemben del splošnega dobrega počutja in za večino ljudi je spolnost pomemben del njihovega življenja in njihovih razmerij. Spolne težave imajo globok vpliv na posameznikovo samozavest in lahko vodijo v depresijo ali druge psihološke težave. Prizadeti so tudi partnerji s spolnimi težavami, kar lahko vodi v težave pri razmerjih ali so celo vzrok za prekinitev razmerja. Ja, ohranitev dobrega spolnega zdravja in iskanje rešitev slučajev spolnih težav je pomembno za ohranitev ali povrnitev kvalitete življenja. Zelo pomembno je torej, da o spolnih težavah ne samo govorimo, ampak tudi spodbujamo bolnike, da o tem sami spregovorijo. Veliko ljudi se sramuje spregovoriti o svojih spolnih težavah in potrebujejo za to neke spodbude. Bolnikom je lažje, če se zavedajo, da niso edini s takšnimi težavami. Zato lahko začnemo z izjavo, da ima mnogo ljudi njihovih let ali z enakimi zdravstvenimi težavami prisotne tudi težave spolnosti. Nato jih vprašamo, če je tako morda tudi pri njih. Vprašalniki o spolnih težavah, ki so na voljo v čakalnici, prav tako lahko spodbudijo bolnika, da spregovori o svojih spolnih težavah. Mnogo dejavnikov lahko vpliva na posameznikovo spolnost, zato moramo bolnike povprašati o vsem. Življenjskem slogu, razvadah, prejšnjih in trenutnih obolenjih in kirurških posegih, prejšnji in trenutni medikamentozni terapiji, pa tudi o osebnih nagnjenih, razmerjih in kulturnih in verskih prepričanjih.
We need to be careful to explain the importance of sexual rights and equality issues, and also the concept of the brief sexuality-related communication. Well, while clients or patients would like their healthcare providers to discuss sexual health concerns, health workers often lack the necessary training and knowledge to feel comfortable addressing such issues. The guidelines, written by the WHO, provide health policymakers and decision makers in health professional training institutions with advice about how healthcare providers can use counselling skills to address sexual health concerns in a primary healthcare setting. It's available and free on the World Wide Web in many languages, and we'll share the link in details.
We are nowadays more aware that sexual problems are often intertwined with relationship problems. When we talk about relational problems, we can think of the type of problems when partners consider ending their relationship. But also less severe relational problems can affect the sexual functioning of romantic couples. For instance, insufficient or even fully absent communication about what partners would like to experience in their sexual encounters. It's not only what both partners actually do in terms of behavior, but also how they may be different in terms of what aspects of sexual activity mean for each of them. For example, one partner may consider oral sex as a perfect way of attempting to please the other partner, while that partner sees it as something disgusting, as something that should not be part of their sexual repertoire. So yes, because most sexual problems occur in the context of a romantic relationship, it's very important to involve the partner when we talk about sexual problems. To talk a bit further about the relational aspects of sexual problems, in my experience as a sex therapist, I have found it very helpful to, when talking with a couple about their sexual problems, to interview them in what is called a circular way. Let's first talk about non-circular ways of interviewing. I can ask a male partner what it feels like when he loses his erection during lovemaking with his partner. But I can also do this in a circular way. When I ask the female partner how he is, in her eyes, experiencing the loss of erection. So I could say, how do you think that your partner feels when you are making love and his erection goes away? When she agrees to answer this question, she has to try to see this situation through his eyes. So she's being empathic towards her partner and towards how he feels. And the male partner, in his turn, he can see that his partner is trying to understand how he feels. Often men with erectile problems are very self-critical and self-defeating. And seeing that their partner is really trying hard to understand them and to look through their eyes, it often can soften their self-criticism. Yes, there is certainly a specific way of communicating with patients who have sexual problems. The first thing is always to tell them, I'm going to ask you a question about your sexual health. It's important that you are at ease yourself and you can get to become familiar with talking with various patients groups and to identify biases that you may have. You should make your patient feel comfortable and what is called establish rapport. Before that you ask sensitive questions. The whole conversation can be made better by using neutral and inclusive terms, by saying partner instead of husband or wife, by posing your questions in a non-judgmental manner. It's very important to avoid assumptions about your patient based on age, on appearance, on marital status or other factors. Unless you ask, you cannot know what a person's sexual orientation is, what his usual sexual behaviors are, what his self-identified gender identity is. Even if you feel uncomfortable or embarrassed, please try to not react too overtly. You can pay attention to your body language and to your posture. When a patient shows you that he feels offended or seems offended or reluctant to answer, you can rephrase your questions. And you can also briefly explain why you are asking that question. The terms that you're using during a conversation are very important, and make sure that you share the same understanding of the terms to avoid confusion, but also not to offend a person. If you're not familiar with what a certain term means for a patient, just ask for it. Another important point is to use correct pronouns and correct terminology when you talk to a transgender patient. Use those pronouns that the patient prefers and support the patient's current gender identity, even if their anatomy is not matching that identity.